there's quite a lot of information in this figure, so let's get right to it. We're looking here at the control of respiration. And when we talk about respiration here, we are specifically looking at the first phase of respiration, which you may recall is pulmonary ventilation. So how does pulmonary ventilation work in the first place? So again, we're going to go back to Boyle's law, PV equals K, and the idea of these muscles right here. This is your diaphragm, and these are your external intercostal muscles, the muscles that are external, that are most superficial, that bridge between ribs. Okay, so the idea is that when these muscles contract, the thoracic cavity expands. The diaphragm pulls down, the external intercostals pull up and out, and the entire thing gains volume. When you gain volume, you lose pressure. So that lower pressure situation means that basically air is sucked down through all of the respiratory mechanisms, all the respiratory anatomy, and directly into the lungs, just through trying to regulate trying to regulate the difference, the gradient between what's going on inside of the lungs and the external air. When the pressure drops here, air rushes in to fill that gap. And that's how pulmonary ventilation actually works. So at its basis, it's muscle contractions. It's muscle contractions. So how do the muscles contract? Under what circumstances do the muscle contract? So there are direct connections, excuse me, from the brainstem. Here's the pons, here's the medulla of the brainstem. Here's the midbrain, by the way, but we're only going to be looking at the pons and the medulla. There are direct connections between these areas of the brainstem and these muscles of respiration. So the neural mechanisms of breathing are in the pons and the medulla. The one that we're going to be looking at here is the ventral respiratory group, the VRG. The VRG is thought to be the pace setter for breathing. So basically, this is the guy who's sort of in charge of it in the first place. And I've seen all sorts of iterations of this picture. I think we're actually still sorting out this question as to who is directly in control of these muscles, which groups of neurons are directly in control. Are there direct connections from any other neurons as well? We're actually not entirely certain on those points. But for now, we'll tell the story simply, and it is a fairly simple story. The VRG, the ventral respiratory group, is both in charge of inspiration and expiration. When you want to inspire air, basically these neurons in this region experience a depolarization, which in turn causes these muscles to contract, and then the volume increases and the pressure drops and air rushes in. And then during expiration, what happens is that the VRG rests. There are no depolarizations, and because there are no depolarizations, these muscles contract. These muscles relax. The external intercostal muscles will go down and in. The diaphragm will go up. That will decrease the volume here. The pressure will increase, and air will be forced out. And that's how expiration works. So that's the VRG. Now the DRG here, excuse me, this is the dorsal respiratory group, DRG. This has connections directly to the VRG. In this case, we are going to be enhancing the activity of the VRG. So the DRG will be active when more strenuous breathing is necessary. So the VRG may be engaging more accessory muscles in the region to enhance the volume of the lungs, or it might be increasing the pace of breathing, or probably both at once. So it'll be increasing the pace of breathing and probably engaging more muscles. Okay, so the DRG will enhance the activity of the VRG. Up here we have the PRG, excuse me, the PRG, which is the pontine respiratory group here. The pontine respiratory group, in this case, fine-tunes your breathing rate. It smooths the transitions between inspiration and expiration, And it, generally speaking, it kind of works by inhibiting the medullary centers. So it has direct synaptic connections to the DRG and the VRG. In general, it's mostly a negative a negative connection. So it inhibits their activity. So next, this is also shown in this picture, which is the factors influencing breathing rate and depth. Now, these guys aren't making these decisions on their own. The VRG is getting a lot of input from different places, as you can see from all these green arrows coming in, from the PRG and then coming in from different places in the body and inside of the lungs and inside of the heart, or very close to the heart, and even in from other places inside of the brain. So the factors influencing breathing rate and depth include pulmonary irritant receptors. This is where you would have, for example, accumulated irritants or mucus inside of the lungs. This might cause you to cough. You have baroreceptors inside of the lungs. These specifically inhibit the medulla and will not allow for any further breathing to take place when your lungs are completely inflated and there's a great deal of pressure exerted outward. It's basically impossible to continue to inflate the lungs. Higher brain centers are involved here too. The hypothalamus is involved in emotions, pain, body temperature changes. Anything like this might cause, for example, a gasp, and that is also input into the respiratory system. And of course, we have voluntary control. The cerebral cortex itself, which is the outermost, most superficial gray matter of the brain, has voluntary control over your breathing rhythm. You can hold your breath if you want to. Excuse me. All right, your chemoreceptors. There are chemoreceptors in your the aortic arch, in the carotid arteries. We've actually seen this before with blood pressure, haven't we? So another thing that's sensed in those areas are dropped oxygen levels, or increase in carbon dioxide levels, or rising hydrogen ion levels. And in this case, you can control your breathing rate depending on what is most appropriate. So we'll go over some scenarios in class of, if your oxygen level suddenly drops, or if your carbon dioxide level suddenly drops, or different things might be happening. What would you want your breathing rate to do? How would you want to enhance your breathing rate or decrease it? So give some thoughts to those classes, to those questions before we actually get to class.